Okay, what is a pivot shift test? That's kind of a funny name. This is Dr. P. Got a problem with your knee? Ask Dr. P. And people ask me all the time, what is a pivot shift test? So this is Taya. She's an awesome woman from Canada who traveled all the way to Skinny Atlas, New York. We really appreciate it. And she injured her left knee actually last February, so quite some time ago, and she tore her ACL. Now, is it 100% torn? We don't know that. You don't really know until you get in there. We can look at her MRIs in a minute, but what we're gonna do is do physical exam to see, the two best tests to check for an ACL tear are what we call a Lockman test and a pivot shift test. Quickly, the Lockman test is taking the knee, and this is her good one, and we're just kind of holding the thigh, and we're just gonna pull forward quickly. And the ACL, the anterior cruciate ligament, prevents the tibia, the shin bone, from sliding anteriorly or forward on the thigh bone, and that's what that tests. Now, the pivot shift. What the pivot shift does is you're gonna hold the heel here, and you just let your leg go nice and relaxed. You don't even have to do anything. And I'm gonna internally rotate her tibia, her shin bone, and I'm gonna put a little valgus stress on that. Now, what does that do? The most dangerous position for the ACL, whether you're skiing, landing from a jump, if you come down and the leg is like this, that's a very dangerous position, and that tends to cause a tear of the ACL. God forbid this happens in the NCAA tournament, but if someone gets injured, just coming down from a rebound or something, or layup, usually look for their leg in that L position, and they probably tore their ACL. So we're basically recreating that kind of L or valgus position. So I'm putting this push on here, valgus stress, and what happens is if she has a torn ACL, the tibia is gonna slide forward. It's gonna sublux out of position. This doesn't feel like it's doing it because this is her normal one. And what's gonna happen is as it's subluxed forward, as I bring it here, you see this banded tissue right here, it's called her IT band, it attaches here. In this position, fully extended, the IT band acts as an extender. It brings the knee straight. But as we bend the knee, that IT band comes back behind the center part, or what we call the medial epicondyle of the femur, and it pulls the tibia back. It becomes a flexor, and you'll feel a clunk. Now in this case, we'll just let this go nice and relaxed, and boom, I don't feel any clunk or anything like that as that IT band goes back and forth. This is her injured knee, and so now I'm gonna do a little Lockman here, and you're gonna see this comes quite a bit more forward and doesn't have a good end point. But we're gonna do the pivot shift now, because that's what this video is all about. So I'm just gonna take with my opposite hand, I'm gonna internally rotate, I'm gonna push this forward. Now this tibia, this isn't super loose, but I do feel, yeah, right there, what she just did there, she actually just flexed her knee a little bit, and I felt it kind of want to go back in. So I'm gonna do that passively. You just let it go nice and relaxed. So this tibia has slid out of position, and as we bring it back, and that you're gonna see her skin move back like that. Now this is, I'm going in slow-mo, but if you go fast, you feel a little clunk right there. Boom, as it pops back in. So, not the loosest one I've ever felt, but you do have a pivot shift, you do have a positive Lockman, so even without an MRI, I'm gonna be very concerned about an ACL tear. And if you have a pivot shift, that's a very specific test. It's not super sensitive, so specific means if we feel it, you probably got a tear, 96%. But it's hard to feel it sometimes because people are in pain and they won't let their leg relax. You're doing a great job. So it's not a very sensitive test because it's hard to get someone to relax sometimes. So very specific, not very sensitive. Lockman is sensitive and specific, but not quite as specific as a pivot shift. So there you have it. Now you know what a pivot shift is.